fortunately, we have wonderful supporters and who made this possible. And the most important group of people who made this clinic remodel possible are our participants in the AIDS Lifecycle, our writers and our roadies, who not only worked so hard to make that event happen, but they raised tons of money. And in the last few years, they have raised record-breaking amounts of money. And it's those dollars that mostly paid for this remodel.
We have about 22 different programs that range the full gamut of a person's lifespan from family planning all the way through to senior services. The keystone of a lot of our services, however, are our health services. We're sort of a national guidepost for rolling out these programs across the nation. So people come to us for training from all over the world, actually.
We're a very robust and very busy pharmacy. There's a total of 20 staff, 5 pharmacists, and the rest are technicians. And we service about anywhere between 13,000 to 15,000 prescriptions a month, which is about 600 prescriptions a day that come through the pharmacy.
Every time they come on and off their medication, it has adverse effects on them, right? And so one of the brilliant things about this is we have a reminder service when their prescriptions are due. We deliver by mail. We're constantly on them to keep them compliant to their medications.
Doctor, the MA, and the case manager all work together on this one person, and they can help that person get housing if they need anything like food vouchers, things like that. These people are here to help them. So now we have an integrated team for each person.
We want to keep the place up and clean and state-of-the-art as much as possible so that our clients come here and it helps with their healing process.
Also have the OA HIP, which is the Office of AIDS Health Insurance Premium Payment Program, and it's run by the State Office of AIDS. And with that program, if someone is HIV positive and has health insurance but is unable to pay their monthly premium, this program is designed to help pay their premium.
Our main goal really is to provide as much of the services as we possibly can to as much of our community as we can. We also have another section of our population is the Transgender program. So we are providing hormone services for trans people, helping them to transition from their gender they were born into to the one that they feel more identified and comfortable with. And we are, the final main program that we have that's in the process of building is our lesbian health program. And that we're really excited about because that's going to really expand all of the needs that we can meet.
I want to introduce also one of our phlebotomists. This is Amanda Frontino. If you haven't seen the Vanguard, Amanda is actually on the cover of our Vanguard, and there's a really great feature story in here, so I'd really encourage you to take a look at this and you can learn a little bit about Amanda's history and her road to the center.
She's a rock star.
She's a rock star, yeah, we love her. 8 years ago when I came here as the director of nursing, there were 17 people in my department. I think I was the 17th. Currently I'm up over 60 people, so that tells you about the growth that we've had. It's been 4 times what it was when I came here, again, almost 8 years ago. And the size of the lab was probably a quarter of this size. So with the remodel, we've gone to 5 draw stations. These chairs are phenomenal. They're fainting chairs, so we were checking to make sure. We've actually had tours come through. Just coming into the lab, they got a little lightheaded, if you will. We see people faint on a daily basis. It's usually because they haven't eaten and they vasovagal, people's blood pressures drop. So first thing you want to do with somebody who passes out, and take this little tip with you, is you want to get people flat and get their feet above the head. Get all the blood back to their head and their heart. These chairs allow us to do that rather quickly, so we're able to recover patients really quick, and if indeed they should pass out. With the increased growth that we're projecting and the need that I think you heard Lorri talk about, we're going to need more support to do all the laboratory work that's necessary to actually support our patient population.